Hey, it's Dr. Kate Walker. Welcome to my interview with Dr. Paul Carrola, who is a faculty member and associate professor.
Yeah, associate.
Thank you. In the counseling department, the mental health program at the University of Texas, El Paso. And he knows all things LPC associate. And I'm going to just ask him tons of questions to make sure that we get down to the answer, because he is the president of the Texas Association for Counselor Education and Supervision, or past president now, right? Okay. Anything you want to add to that intro?
Great to be with you, Kate. I think that there's a gap between, I think, being a student and being licensed that I think is very confusing for a lot of students. And we do our best to try to communicate to our students what they need to do, but I think there's still, across the state, there's a lot of uncertainty with what they're supposed to do. Mm-hmm. So I'm really happy to talk about this topic.
And it changes every semester, right? I mean, it seems to, and so it's hard to even make these videos and then carry them over because something's going to be different. So I really appreciate you doing this.
No problem.
All right, so I'm just going down the list. How do I become an LPC associate in Texas?
Right. So what's required for the LPC associate license is having a master's degree in counseling or related field, an academic degree, an accredited institution, and it can be counseling or related field. It needs to be a 60-hour program. There's academic requirements. If you look on the LPC BHEC website, they have Texas Administrative Code will actually list all the specific things. And I can send that information out so people can look at it. It'll say the academic content, the classes, and everything. And that's kind of tricky because it changes sometimes. The LPC board will change requirements at times. So we really want to make sure you're up to date with what the current requirements are. So in addition to academic requirements, need to pass the NCE, which is the licensure exam that Texas uses. Now, there's some confusing things about that, the NCE, which I can talk about, because the state allows 2 exams to be used for licensure. One is the NCE, National Counselor Exam. The other one is the Clinical Mental Health Counselor Exam, the National Clinical Mental Health Counselor Exam. That acronym is like a mouthful, so I don't even say it. But really, it's the NCE, and I say that because the only reason the other exam is there is for usually people that come from other states where they took that exam, because some states require that exam instead of the NCE. It's really difficult to take that National Clinical Mental Health Counselor exam if you haven't taken the NCE. And the NCE is a more foundational exam. It's multiple choice, similar to what a lot of preparation exams will give you and program and in your academic program. The National Clinical Mental Health Counselor exam is a more complicated exam. It's based on scenarios, and you have to select the most correct answers, and it's a more complicated exam. And so really we should be preparing our students, and you should be prepared to take the NCE for licensure. There's an application packet that there's fingerprinting and background check required. You need to have a supervisory agreement. So you need to find an LPC supervisor. Must be an LPC supervisor, right? That question gets asked a lot. Who can supervise you? And there's a lot I can talk about. I know you might have some questions about the supervision part, but there's a lot I have to say about that. But as far as the application, so you need the degree, you need the exam, you need background check, a supervisory agreement, and you also need what's called a jurisprudence exam, which is a no-fail exam. And that exam basically goes, when no-fail means that if you take it, you miss some questions, they say you take it again, or you keep doing it till you get it right. And so it's basically highlighting issues that the LPC board has seen. Here are some violations we've seen, things that people have done wrong, right? Where people have messed up. And so we want to, whether it's documentation, dual relationships, whatever it is, whatever they're seeing the most problems in, they're going to put that in the jurisprudence exam. So it changes, right? but it's a no-fail exam, so they're trying to reinforce some information to you. And that's pretty much, the packet has there's different forms you need in the packet, but that's basically the application packet.
So how do I take, if I'm a student, if I'm a grad student, how do I take the NCE? Do I take it before I graduate? Do I take it after I graduate? How does that work?
So that has changed recently. Before, you used to have graduated. You had to submit your transcripts and they would verify that you graduated from a program. Now you can take the exam while you're a student. Now here's the confusing part that students mess up. But they don't mess it up. They just kind of, they get caught in this little situation. So you can take the NCE for two reasons: licensure or credentialing, right? Now, the NCE allows you to be credentialed as a nationally certified counselor. That's the national exam is used for that credential. It's also the state of Texas chooses that as their licensure exam. So because there's those two pathways to take it, when you go online, you need to make sure you're selecting taking exam for licensure. Because if you're a student and you want to take it, they will let you take it as a student as well for credentialing, but it's a much more complicated application process. They ask you need permission from the faculty in your program to take it. And it's something that the program organizes with NBCC so that students can get on track to get that credential. They can take it early. Now, because you can take the exam for licensure as a student now, there's no need to go that route. Take it if you're a student, take the exam for licensure. You can always get the credential. Once you've taken the exam, you can get the NCE, the NCC, Nationally Certified Counselor, later, right? Mm-hmm. But it's a very simple process to take it for licensure when you're a student. So you have to make sure, and there's specific links, and you always look, if you go to the website, make sure for examination, register to take examination for licensure, mm-hmm. right? Credentialing, they're two different things. I know credentialing can mean licensure too sometimes, but they're talking about the Nationally Certified Counselor credential.
In Texas, that doesn't really mean anything, right?
It's something. If you want to, you can have something extra on your another credential on your name, and maybe if you move to another state, that can maybe you carry that credential mm-hmm. with you. Maybe the licensing board over there will say, okay, you have the credential. Maybe that can carry some weight there. But yeah, the license is what you need, right? That's what you mm-hmm. need to practice, is the license. Mm-hmm.
So taking the NCE, then I'm going to go to the website. I'm going to click the link. I'm going to make sure that I'm taking it for licensure. You mentioned only an LPC supervisor can supervise an LPC associate. So as a grad student, I've got to find an LPC supervisor to sign my paperwork, right?
So yeah, you need to have that supervisor agreement. And so what every student should be doing during practicum and internship, they should be networking. There's going to be LPC supervisors at your practicum and internship. Maybe they're not going to be the ones that are going to supervise you, or maybe you're not, but you need to talk to them. You need to talk to your site supervisor about supervision. Sometimes they'll have an LPC supervision license, sometimes they won't, but they're going to know people that do. And so during that time, you're building your networking. You need to. This is the process that I recommend, right? You're learning about supervision when you're a student, and so you have an idea in your mind what you want out of supervision. Different people will want different things, right? Sometimes you may want a specific skill that a supervisor has during assessment or some intervention, right? Mm-hmm. You may want someone who has a lot of access. You have a lot of access to. Sometimes, honestly, people they just want to have a supervisor that's at their place of employment, so it's part of a package deal, right? So everyone has a different kind of priority list of what they want out of supervision. So you need to list what's important for you out of supervision, and then you need to look for supervisors, and you need to interview them during your practicum and internship. Set up interviews, at least 2 to 3 supervisors, LPC supervisors. And maybe initially, you're just, like I said, you'll see some LPC supervisors, just meet with them and ask them about supervision, how they do supervision. What do they look for in LPC associates, right? Obviously, you want to have a good, you want to be able to have good references from your faculty, your professors. But you want to, by the time you're graduating, you don't want to be in the situation, oh, now what do I do? You already want to have a plan in place. By the time you're finishing internship 2, your last semester, you should already have in mind, if not already know who your supervisor is going to be, you should have an idea that it's going to be 1 or 2, a group of people, right? Some people that you have in mind already. So, and you should already know what that supervisor's expectations are, and they should know what your expectations of supervision are. So that time as a student is really a great time to learn about supervision. So you know how you don't always have a choice when you're a student who's going to be your supervisor. You do have a choice for your licensure, for supervision for licensure. It's a two-way street, right? When you interview them, they're interviewing you and you're interviewing them. You want to know, are they going to meet your expectations? And they want to know, are you going to meet their expectations? So you should feel a bit more empowered by the time you graduate to be a little bit more assertive with what you want out of supervision.
So one of the questions in dovetailing off of that is this idea of what is a direct hour, right? So if I know I'm going to be a school counselor, it's important that I get a supervisor who understands what a direct hour is in a school setting versus if they have no idea what a school counselor does and what is, right? Because what do you teach students is a direct hour?
All right, so we have a very specific, for when they're students, we have specific categories of what direct client contact means, right? However, the short answer I give students when they say, what counts as direct when I'm getting my licenses, you know what counts as direct? Whatever your supervisor says counts as direct. Your supervisor decides what is direct and they sign off on your hours. So it's their discretion. Some may say, you know what, you're co-facilitating a group, I'm going to count that. Another may say, no, that doesn't count. Or you're shadowing, maybe there might be a supervisor who says, well, that counts. Another will say, no, it doesn't count. So obviously there's going to be some gray area. I'm doing client contact. I'm calling clients, or I'm doing consultation with a parent about about their child who is a client. Does that count? So there's some gray area, and every supervisor has different ideas about that. So you need to discuss that with your site, when you're looking at who the site supervisor is going to be. So it 100% depends on your site supervisor, right? On what it counts as a direct or a non-direct hour.
I want to ask the next one about accreditation, but I think this is important to dovetail off of that, because the idea of being self-employed, right? Because you are allowed to accrue direct hours in a self-employed setting, but it's back to this, if your supervisor says it's okay, right? I mean, if your supervisor is not comfortable supervising self-employed hours, you won't be able to work or create or do anything in that setting, right? It's ultimately up to the supervisor.
Yeah, I think, they put, supervisors are responsible for their supervisees, right? So a supervisor is going to want to supervise someone who doing something they have competency in. So if you're going to be in a private practice off the bat, it's probably a good idea to look for a supervisor who has a lot of private practice experience, so they can kind of guide you with that. You don't want to select, and I know sometimes people will think, well, I want someone who's just, I know students don't think this, but sometimes maybe they think, I just want someone who's going to sign off on my hours. Yeah. No, that's not what you want. You want someone who has expertise in what you're going to be doing. So yes, any LPC supervisor could hypothetically supervise you if you're in private practice, and some may even agree to do it if they don't have any experience in private practice. But I would not recommend, if you're that student who's going to graduate and wanting to go into private practice right away, I would not recommend having a site supervisor who doesn't have experience in private practice. I would really seek out a supervisor that has that experience, because you want that support. You want to be able to go to supervision and say, I have this issue that's specific about private practice, and they can be able to actually respond to it. And if they're maybe working in a school and they've never done private practice, they're going to be like, well, I don't know. You don't want to be in that situation where you have a urgent situation and your site supervisor doesn't, or your supervisor doesn't know.
Yeah, I think that's a huge point. All right, I'm going to back up, because you said earlier, when students are applying, you have to have a master's degree from an accredited institution. And I want to make sure that we understand that doesn't necessarily mean KCREP accredited. It's just an accredited university. And so talk a little bit about that.
So KCREP accreditation, right? It's a national accreditation that is really, it's really good because it standardizes a lot of things that we do in preparing students. But the licensure for Texas, being licensed in Texas, does not require that you graduate from a KCREP accredited program, right? There's some obvious differences in what Texas requires and the KCREP requires. There's a lot of similarities, but there's some differences too. And at some point, like as we were saying before, things change. Who knows, in the future it could change. But at this point, it's not required. When it means by accredited institution, it means the regional institutional accreditation, right? Programs are accredited by KCREP, right? Or specifically of whether it's nursing or whatever kind of program it is, they have accreditation for that specific focus, right? But universities or institutions have regional accreditation. Like the one we have is SACS in Texas, usually Southern Association of Accredited Colleges, right? Which means that our institution meets certain standards, right? And it's just basically has to do with different metrics, graduation rates, and certain outcome data that they collect, but it's for the whole university. So the whole university covers that accreditation. And if your university has that accreditation, it meets that requirement for licensure that says you need to be accredited institution.
So if I don't come, and I see threads sometimes on social media where they talk about, gosh, I didn't come from a KCREP, going back to this idea of KCREP and the program accreditation, right? I didn't come from a KCREP accreditation. How do I make sure that my application goes through smoothly? And I know UTEP is KCREP accredited, so, it's hard to speak to that, but for your students, they know when they put their application in, it's going to be pretty quick because staff knows what to look for. Non-KCREP accredited, they might have to include or get real specific and make sure that they have a syllabus ready if they're asked for it, or they have some other information about a course if staff comes back, and it might delay their application a bit.
Yeah, I mean, so it's really, you want to do your due diligence and looking at the academic content requirements that state, all the different areas that are required. Like an example, KCREP has the 8 core areas. Texas LPC board is a little bit different, right? A lot of overlap, but it's not the exact same 8 core areas. There's things like addiction and things that are a little bit different. So you want to look at that content area, that course content requirement, and look at your transcripts. Does it easily match up? Does the name of a class, like say, addictions is one of the content areas, then do you have a class that says addictions? Or maybe substance abuse or something similar. If it says something that's not quite that, like, then you may need to be ready with the syllabus. And there's some classes that there's like abnormal, the names are like abnormal human behavior, then there's psychopathology. Well, those are kind of the same, but you want to make sure that if the name is different, if the name of the class is a little bit different, then you have that syllabus ready and you make sure that it meets that, what that content area is. So having the syllabus but reviewing your transcripts ahead of time, because sometimes you may find out that, I'm missing this. And if you're missing something, I need to take a marriage and family class. Oh my gosh, because that's part of the requirement and I didn't take it in my program, right? Addiction, I think those are two I'm thinking of, addictions and marriage and family. That is not, it's not a KCREP core standard,
Mhm.
right? But it's required for LPC course content for application. So you want to look to make sure if anything's missing. If anything's missing, take that. You need to find a way to take that class, right?
So that's my follow-up, and I know we're running out of time, but I get asked a lot by graduate students in an LPC track, well, can I go sit for the LMFT exam? Right. So how does that work?
So some programs will offer the LMFT course content. So it's going to be what's on your transcripts.
Okay.
So required, and you need to look at the LMFT licensure code. It has specific course content, and I think off the top of my head, there's like you have to take about I think like 4 or 5 classes specific to marriage and family. And in your practicum and internship, it has to show that you did some marriage and family.
There's extra practicum, there's extra ethics, and
So you need to make sure that look at those requirements and then see what your program is missing. So maybe, you took like 3 classes in your master's program, so it didn't meet the requirement, and say, okay, I need to take 2 more classes and I need to do maybe a practicum, or I need to find out how that's going to work, right? So you can still meet those requirements afterwards, but you really need to look at what those requirements are and see where the gaps are.
That's what I did. I graduated with a 36-hour program back in the day. So I had to go back and pick up a lot of hours so that I could sit for my exams and get my license. So anything else you want to throw out there that students need to know as they're on their journey to become an associate?
I would say that now, because of the technology and virtual spaces that are now available now and such high prevalence, that distance supervision is something that is possible now, right? And so think about that, but don't automatically jump on, oh, I'm going to do distance supervision. Think of it has to be a good fit for you, right? You ask yourself, do I really want someone who's local here that has knowledge about, the agencies here and the professionals here and what's going on in my community? Or do I just need someone who has maybe there's someone who has a specific skill that's not locally where I'm at? Then that might be an option for you. So it's a new option, but just, I think be thoughtful about it, and before you decide, oh yeah, I'm just going to do distance supervision, right?
Awesome. Well, thank you, Dr. Carrola from the University of Texas El Paso Mental Health Program and counseling expert, and TASE's past president who knows all things supervision. This was great information. So thanks everybody for watching, and I'm going to click pause.